Today I'll be talking about 5 tips for immediate back pain relief. Hi, my name is Rebecca Meyer, and if you're new to this channel, first let me begin by welcoming you. I predominantly do stories about my life as well as vlogs and some tips along that way. So if you are interested in hearing that, make sure you hit that subscribe button and don't forget to ring that bell. So today I'm talking about the 5 tips for immediate back pain relief because I've just gone through surgery for a herniated disc. Now I obviously had pre-pain and I've had post-pain. So I thought I'd share my tips for getting rid of some of that pain. Now the first tip that I'd like to go over is actually using ice. I believe that this is often misused. Many people do like to place a towel between their injury and this, but I actually believe that that inhibits the ice to work. So what you can do is actually go ahead and put your ice in just a regular sandwich bag. Do not use a towel between the ice and your injury. Now, of course, if you have like an incision or something like that, that's going to be different. But if you have no, breaks of skin on the back or anything like that, you can just go ahead and put your ice directly on your skin. Now what you're going to do is put that ice there for 15 to 20 minutes. The whole goal is to get that skin or that area to actually start to feel numb. So that's going to take approximately 6 to 7 minutes in order for that to happen. So at least if you can get it to that 6 to 7 mark or that numb mark, you're going to be in better shape. Now I personally like to keep it on there for 20 minutes, but I do want to put a little disclaimer: do not keep it over 20 minutes or you could actually cause frostbite. Okay, so my tip number 2 is actually going to be using Salon Paws. This thing is fantastic. It's an over-the-counter gel patch that does help with pain relief. Now, the over-the-counter ones start, they can start as low as 2%, 3%, but what you want to look for is the 4%. That's going to be the highest available over-the-counter. Now, you can get these as a prescription at 5%, but these are fantastic. They last all day long, and these are insanely good for help. Now, tip number 3, super important. You need to be using anti-inflammatories. So if you are using something like Tylenol, Tylenol is not an anti-inflammatory, so it's not going to help to relieve as much pain as an anti-inflammatory would. Of course, Tylenol is going to be great for things like fevers, and they are good for some like basic aches and things like that. But if you're in severe pain, severe back pain, then you're going to want to be using an anti-inflammatory. So that's going to include ibuprofen, Advil, Aleve, some things like that. So definitely stick with the anti-inflammatory. All right, excuse the location change. All right, and tip number 4. This one by far and wide is probably the most important of all the tips I've given you and will continue to give you today. This one includes anti-inflammatory food. You need to change your diet. I'm not kidding, and I know you've heard this before, and I know you kind of believe it, but what I'm telling you now is going to change your life if you decide to make these small changes. All right, so let's get into it. So the very first thing is no added sugar. No added sugar. What does that mean? Anything that you might add into your coffee? No. Anything that you might put on cereal? No. No added sugar. In addition to that, it also means processed food. If you look on the back of 90% of the packages that you might have in your house, it's going to have things like lactose, fructose, sugar. Those are things you need to stay away from. Sugar is very inflammatory, and that is predominantly probably why you're having such severe pain if you are, and that is by far, you have to stay away from that. Another anti-inflammatory food is milk. If you go and look at your milk container in the fridge, you are going to find that it has sugar in it. So you cannot have milk, you cannot have cheese, you cannot have creamy things unless it was made without milk. There are substitutes that you can use that honestly, if you just give it a shot for about a week, it'll be just fine. And so, for instance, I have moved over to almond milk. So almond milk would be a really good substitute for milk, but milk is another inflammatory food, so no more milk. You also want to make sure that you're staying away from red meats, pork, smoked foods, and barbecue. Believe it or not, I had no idea that those were issues, but that was the directive given to me by my surgeon. And you know what? He was right. And I'm sure he went to school for many years to learn that. So, yeah, so stay away from red meat, pork, barbecue, and smoked foods. Very last thing on the list is water. You need to hydrate. You need water, water, water. Now, when I was in the midst of my insane pain, that my absolute agony, I was drinking between 10 to 15 bottles of water a day. Now, I'm not saying that you need to drink that much. I am, however, saying that that helped me tremendously. At least get in 10 ounces 10 times a day of water. To make it easier on yourself, just forget about all the other liquids that you may be drinking or ingesting and just stick with water, because you're going to find if you hydrate yourself, it's going to help you feel a lot better. Thank you so much for watching today. I really do appreciate it. If you enjoyed this, make sure you hit that like button. And if you want to see more content like this, make sure you subscribe and don't forget to ring that bell. Thanks again for stopping by, everybody. See you later.